All right, we are live on Facebook. Thank you all so much for joining us today for this presentation on lymphedema and cancer. This is Jill Kimberlin with AquaCare, and she'll tell you a little more about herself, but she is a certified lymphedema therapist and has lots of great information to share with us today. Um, Jill, let me know when you want me to pull up the slide. And everyone, Jill has said she can take questions anytime. So feel free to ask questions throughout. You can either just ask the questions or you're welcome to put them in the chat and I'll make sure Jill gets them. And if you're watching this on Facebook Live and you have any questions, please feel free to type your questions in the comments and I will read them out to her. All right. And I will turn it over to you now, Jill.
All right, thank you. Thanks for having me. Um, as you said, my name is Jill Kemmerlin. I am an occupational therapist and certified lymphedema therapist. I work for AquaCare in Lewis, Delaware. I also have some other therapists here that help me treat lymphedema. Melissa Martinelli and Lane Gable are in the Lewis area. We also actually have some therapists in the Maryland area through AquaCare that are treating lymphedema as well at our Salisbury office and our Easton office. So if anyone needs any further information on that, I can get it to you for your closest AquaCare or closest lymphedema therapist to you. I'd be happy to help with that. All right, you can start the slides then.
All right.
All right, so this is just introducing myself again. So just personal note on about me. I am actually a melanoma survivor, and I was diagnosed about 15 years ago and had a full lymph node dissection of my left groin, resulting in lymphedema in my left leg. So not only am I treating patients with this on a daily basis, I live this on a daily basis. So it's something that I'm really passionate about, not only professionally, but personally. So wanted to be here to be an advocate and, hopefully really empower people to help themselves if lymphedema is something that they experience after any type of cancer. All right, next slide, please. So why lymphedema can happen and how cancer, really affects the lymph system. Anytime that you have surgery for a cancer, whether it's the removal of a tumor itself or taking the sentinel node, as some people have, depending on the type of cancer, that is disrupting that drainage that our fluid runs throughout our body. It mirrors our circulatory system pretty much. So if any of that is disrupted, that is when lymphedema can be a risk from surgery to remove any type of cancer. And then following that surgery, scar tissue is something that can really impact the lymphatic system. Following that as well, radiation. As anybody that has had radiation, they can causes even more scarring to not only externally, but it internally damages the lymphatic system. It's doing its job by killing that cancer and promoting health and from getting rid of the cancer, but ultimately it is affecting healthy tissue. So not only just the surgery, but the radiation. Chemo can play a part when it comes to radiation, or excuse me, when it comes to lymphedema. But typically, when the lymph nodes are removed during surgery and radiated, increases the risk of lymphedema. Next slide. So it not only happens in just breast cancer. A lot of people think, from the removal of an axillary node from your armpit during breast cancer, people can develop lymphedema in their arm or their chest wall. It can happen in gynecological cancers, prostate and testicular cancers, oral and head and neck cancers. Anytime that lymphatic system is injured or radiated or those lymph nodes are removed, can cause lymphedema in these areas. So any women with gynecologic cancers, experiencing lower extremity swelling, this can happen from the removal of any groin or pelvic lymph nodes that are disrupted. Same thing with prostate and testicular cancers. Those nodes are radiated or removed during this cancer treatment. The head and neck, which I don't see a ton of. Personally, I've had a handful throughout the years. Um, but this is, an up and coming problem, because there's not many of us around here to treat this. And it can be very disfiguring when you're radiating the neck and the face. But I am qualified and trained on how to help that too. So again, not only is it breast cancer, it can be any type of cancer that affects the lymphatic system all throughout the body. Next slide. So when does lymphedema happen? Um, there's no real definitive linear timeline with this. It can be almost immediately after surgery because that system was disrupted and disconnected, um, which then raises that lymphedema risk anytime that those lymph nodes are removed. When there's radiation involved after that, again, that would also increase your risk to develop lymphedema. Other personal factors that might also increase the risk, being obese, any type of previous uh, infections that you may have experienced before that, or repeated traumas to that limb or area, increases the risk for lymphedema. And the bigger thing is a lot of people go 10, 15, 20 years post cancer. Um, and a single cat scratch, a bug bite, can trigger lymphedema to come on. And it's not to scare anybody, but these are risks that, that lymphedema is always a risk anytime that lymphatic system was impaired. Um, so it doesn't have to be immediate post-op, a week, a month, a year. It can be at any timeline in a cancer survivor, unfortunately. Next slide. So some signs and symptoms to look for and watch for. The sooner the better, honestly. You don't want to wait until you have a limb or a swollen area that's out of control and we have to play catch up. So really things to look for, obviously visible swelling. If you're seeing any type of change in how your clothing fits, even just like your sleeve here, if it's feeling tighter on one side or the other, your pants feeling tighter, your socks leaving indentations on your legs. So those little things that might seem, oh, I had too much salt today. Oh, I'm not hydrated enough. If your lymphatic system has been impaired, it's very important to monitor closely these signs and symptoms. A lot of people complain about feeling limb heaviness in their arms or legs. It's not quite like a muscle fatigue, but it's just like they have a lot of difficulty raising their arm. There's just a feeling of heaviness, fullness, tightness. These are all kind of buzzwords that I like to, really have people pay attention to if they're feeling any type of sign or symptom. Um, Skin changes, that's another big one. If there is uh, dimpling of the skin, that can be a sign of lymphedema. There is a phenomenon, we'll call it, peau d'orange. No, I don't speak French, but it's orange peel skin. So that's when that dimpling of the pores occurs because there's swelling in the area. It is very common in the breast that you'll see that orange peel skin, but it can happen anywhere. So that is something really to look for. A lot of chest and breast swelling. People think, oh, well, I had breast cancer. I radiated, my breast will never be the same. Well, it shouldn't be hard and rigid. And these are those signs and symptoms that lymphedema is occurring. Same thing in your legs, abdomen, back. It can be anywhere. So really doing like a full body check to monitor any of these signs or symptoms. Next slide. So how we diagnose lymphedema? A lot of times it is misdiagnosed or underdiagnosed. A lot of people think it's post-op swelling. Um, And it can be more complicated than that. Yes, of course, there's going to be post-op swelling or after, radiated tissue is going to be hot and warm. Um, but lymphedema has a different appearance to it. Typically, it is diagnosed by your surgeon or your oncologist. Um, if they're noticing a sign of more than just post-op swelling. So the biggest thing to do here is what I like to call prehab. If we can see a patient prior to any type of cancer surgery, that's best case scenario. That way we can get baseline measurements and numbers so we know what you had going on prior to surgery. So that way when you come in to see me post-op, we can monitor those changes. Um, so I will have some people, as soon immediately post-op, because they know the risks of lymphedema occurring, that they'll measure their limb size. That's typically how I monitor girth changes, is just a simple tape measure, wrap it around whatever you're trying to measure, whether it's your, head and neck, your chest, arm, leg, your abdomen. A simple tape measure can, really just comparing those measurements. To image this system, it's pretty complicated. It's not typically offered around here to call it diagnosed lymphedema, which is called lymphoscintigraphy. That is offered at big university hospitals, Philadelphia, Johns Hopkins, UPenn, things like that, offer those lymphatic diagnostic tools. But that would actually visualize where that lymphatic impairment is. They might do that, to find that sentinel node if during the cancer surgery to find out what node to remove. But after that, that's typically not really an image that's used, I would say locally, to diagnose. I have diagnosed lymphedema. I'm not a doctor, disclaimer here that I do not have MD or DO or anything like that, but living it and being a certified lymphedema therapist, I know the signs and symptoms to look for and can help navigate that. So anyone that slightly is ever concerned of, you know, any type of swelling that may just not seem normal, I'm happy to do a consult with you. We can always do that and send me pictures, send me emails. Um, I can always help navigate that in that way. All right, next slide. So once you get that unfortunate lymphedema diagnosis, no one wants to hear it. You just battled cancer, you're a survivor. I beat it. Let's move on. And then sometimes lymphedema comes back and is another problem to deal with, unfortunately. But there is ways that we can help maintain this and keep you in control of that. Um, so lymphatic massage, that is something that I do. I am trained in doing to treat lymphedema. But it is something that you can do yourself. There is 1,000 YouTube videos on lymphatic massage. However, it is a specialized technique that I do recommend, a trained therapist to teach you. We have lymph nodes, all throughout our body, from head to toe. And so there is a certain sequence when doing that lymphatic drainage massage to help stimulate any of that flow that's lacking. Again, skincare. Taking very good care of your skin is huge and important. It seems trivial. Again, if you've been through radiation, your skin was just radiated and it might have been burned. Any type of infections there can be a trigger for lymphedema to start. So really keeping the skin clean and moisturized, just helping to prevent any type of infections and complications is key. So this says about, where protect your limb from cuts, burns, and or tight clothing. Well, typically compression is something that we do to manage lymphedema. So the tight clothing people get very confused of. Tight clothing meaning anything that's going to create like a tourniquet at a limb. So even a compression garment could act as tight clothing. Jeans that dig into your belly that's going to just be too tight that lymphatic system can't flow properly. So wearing the correct compression and just loose fitting clothing so you're sure that nothing is impacting or um, triggering that lymph system to slow down even further. All right, next slide. So here's where I come in to help treat this. So compression garments, I just spoke of that. You can buy any compression garment under the sun on Amazon. However, there's not the greatest compression garments on Amazon. They're typically not medical grade. And it just either gives you a shoe size or simple measurements. However, we are trained to measure and get you the correct garment to really fit your needs and kind of decide, where we want to direct that flow, depending again where you're swollen. The manual lymphatic drainage, again, this is a technique that I do and can teach you or a caregiver how to do. It is fairly simple. It just takes practice on how to do the right sequence and, where we want to shift that fluid to. And then the complete decongestive therapy. That's what we call the gold standard treatment when it comes to lymphedema. That includes bandaging, and the skincare, the massage, compression pumps. A lot of people have questions about compression pumps, again, because they're kind of on the market now on Amazon. But again, not the greatest choice because some of those cannot be, again, the right flow or mechanism to move that fluid where we want to move it to. So the really gold standard to treat this is the CDT, complete decongestive therapy, because ultimately we're congested in that lymphatic region that's impaired. So what we are doing is decongesting that area, moving it, and helping our body recirculate and get rid of some of that toxic waste of the lymphatic system. Next. Exercise. There's lovers of exercise and haters of exercise, but it is super important when it comes to moving lymphatics. A recent conference that I just attended, they really focused on how imperative exercise is in this population. Again, you may not be able to walk a mile that you were able to do prior to your cancer treatment, but we just need to keep moving and keep that lymph flowing. Or we like to say in the therapy world, motion is lotion. We want everything to keep moving, and we do what we can. So again, if you have a CLT to help guide you through some exercises on that, anytime that we can cause a muscle pump to help pump that fluid out through the body and not stay stagnant and building up further is important. Another thing that I like to mention too is wearing compression during exercise. Very, very important. Because as we exercise or move or walk, where our muscles are pumping, causing increased fluid to that limb. And if it's not compressed, then that fluid just wants to stay there. So that compression garment is going to help move that fluid and pump it out as we're exercising. And of course, just building healthy habits in general. Better sleep, hydration, balanced diet. There is some recent research about eating an anti-inflammatory diet when it comes to lymphedema. I think it can always benefit people when you at risk to develop lymphedema, but there's mixed research about a true anti-inflammatory diet, that is it beneficial or not. But again, watching your signs and symptoms during exercise and really kind of doing what you can and or to your tolerance, and having a trained therapist help you through that. Next. And then we have the emotional and just daily life impacts of lymphedema. This can be very emotional for a lot of people. Again, they've been through cancer, they're a cancer survivor, and they thought their trials and tribulations might have been over. And then we have to deal with lymphedema after that. However, it's manageable and it's not life-threatening if you manage it properly. But again, can be a very challenging mentally, emotionally matter for not only um, the cancer survivor, but a caregiver as well. Because a lot of times you might need to help somebody put their compression garments on, help them with the MLD. So this can really be a change in lifestyle of your daily routine before you even wake up, putting compression garments on. Um, so really getting the support and a good support system to help you manage the lymphedema is the best thing that you can do. Next. There is some new research, again, from this recent conference that I attended, that was brought up. They are trying to limit the risk of lymphedema, which is awesome. Um, some surgical techniques that are out there, some plastic surgeons are doing it, but also oncology surgeons are doing it. So as they are removing a lymph node, they are creating a what's called a lymphatic bypass during that same surgery to limit that risk of this lymphedema to develop. It is up and coming. It's happening more often. And again, unfortunately, bigger hospitals than us here in local Lewis, Delaware. But hopefully it will be the new norm of any type of cancer surgery where they are really trying to spare lymphatic tissue removal. They're also doing something called reverse mapping, and that's specifically for breast cancer patients when they are highlighting the lymphatic pathways through that lymphocytography that I spoke of before to see where that fluid is draining to and trying to limit the removal of those lymph nodes again. Again, this can be in any type of surgery, not just for breast cancer. So they really are trying to limit the lymphedemas from happening by really protecting that lymphatic tissue. Before, years ago, they would just go in and take all the lymph nodes just in case. But now they are really, there's tons of new research too. They're even doing silicone lymph nodes that they're implanting to create that pathway. So there is things out there that we might see in our future that I may not have to treat lymphedema anymore, which would be great. But so there is new hope and research and advances that are coming in the lymphedema world. Next. So just really takeaways from this, knowing the risks, symptoms, and the treatments that are out there. Being proactive. Again, I talked about that prehab. I think that's really imperative in the cancer community, not only just for lymphedema management, but for exercise, to get somebody to monitor your journey through this whole process. That there is new research studies out there that people who exercised prior to cancer surgery had better outcomes. So really just being proactive and moving your body and really helping limit the side effects of cancer surgeries and treatment. And then again, just leaning on your community. There's this great cancer support groups here that has given me the opportunity to speak today. So thank you. And there's support groups. I am here as a resource. I have many clinicians all over the country that I've made connections with. There's Facebook groups, and there's so many people dealing with this that um, it's a personal journey, but people are be surprised of how many other people are dealing with the things that you might be dealing with. So I would just suggest, really lean into the cancer support group because they might know somebody that knows somebody that can lead you to the right person. Again, I'm located in the Lewis office in in Sussex County, Delaware, and we are working on adding some more therapists throughout Delaware, so we can continue to help this population. So just really, I thank you for having me here today, and we can hit the last slide here. So again, thank you. I appreciate your time and thanks for kicking cancer's butt. And I hope to help you with any other problems that may arise through your cancer journey.
I have a question. Can you hear
Yes,
me?
go ahead. Yes.
Yes,
Okay. Thank you, Jill, so much.
sure.
Is there, um, can lymphedema increase pleural effusion?
So there is some risk factors when you're treating lymphedema. We don't ever want to overload the system. So if somebody's followed by a cardiologist or a nephrologist, pulmonologist, any of those other specialties, I do like to speak to them um, to make sure that they are safe enough that I can move that fluid to where it needs to go. So if too much fluid is moved too quickly, yes, it can overload the heart, the lungs, all those things. So when treating it, yes, you need to watch how much fluid you're moving too quickly.
Really? And how do you know that?
I mean, so signs and symptoms to look for: shortness of breath, um, the abdomen filling up. If you had swelling, in the arms or legs, that would be signs and symptoms of volume overload, which can ultimately end up being a medical emergency. So typically, someone that I am treating that has those other type of health history problems, I closely in communication with their cardiologist, nephrologist, pulmonary, like again, primary care, whoever I need to, monitor their condition.
Would keep the exercise going through the stomach instead of up near the above near the breast, the
Say,
fluid.
say that again.
Will you pull the fluid mostly into the side by the stomach, or maybe not go up near the breast and pull it over there?
Right. So you have some deep abdominal nodes that I probably would use and really try to,
Right, yeah, I have.
to redirect that fluid where we want it to go that's not compromised.
Okay, thank you. I gave you
Sure.
some good ideas. Thanks.
If anyone is watching on Facebook and has any questions, feel free to type them in the comments. If I don't get any comments on Facebook, I'll end the Facebook stream soon so people on Zoom can have a little more privacy to ask their questions in just a moment. But feel free to ask anything now, guys.